The use of antibiotics in livestock is quickly becoming a hot topic for debate. It is not a new practice, but moral and health concerns about it have only recently become an issue in the public eye. Is it right to treat food animals with antibiotics if they're not sick? To answer that question, we must look into the history of the practice and at the social, political, and economic aspects of the matter. Animals get sick just like humans do. Since the discovery of antibiotics decades ago, farmers have been administering them to their livestock. The four main reasons are for the treatment of disease, control of diseases, disease prevention, and growth promotion. If an animal is sick, it is given an antibiotic to combat the illness. If several animals are ill, the rest of the population might be treated with an antibiotic to help prevent an outbreak. Because livestock live in close quarters and are in frequent contact, often sharing water and feed throws, disease can spread rapidly. In order to prevent even one animal from falling ill and possibly contaminating the rest, antibiotics are sometimes administered before any of them are even sick. Some antibiotics can even destroy certain bacteria in the digestive tract of the animals, which helps quickly convert food to muscle, causing the animal to grow rapidly. In fact, the animals had about a 3% increase in growth and weight. For obvious reasons, this maximizes profit for the livestock producers. In 2012, though the FDA asked livestock producers to voluntarily phase out the use of non-therapeutic or growth promotion drugs, antibiotic use requires caution because their misuse or overuse can lead to antibiotic-resistant bacteria. When their survival is threatened, bacteria put up their best defenses. Resistance can develop if the bacteria are challenged but not destroyed, as might be the case if the wrong antibiotic was administered, to dose was too low, or if the treatment was too short. There is a concern that treating the animals we use for meat with antibiotics too freely is resulting in antibiotic resistance in humans. Denmark was the first country in the world to enact a ban on any antibiotic use in food animals. Aside from those used specifically to treat sick animals, according to the Animal Health Institute, the results of the ban were not what many people were expecting. There has been an increased rate of disease and death among the animals, particularly young animals. Greater amounts of antibiotics are needed to treat animal disease. Although overall use has decreased, total use declined by 26% between 1998 and 2009. While quantities used for treating disease increased 223%, resistance to some antibiotics has decreased, but resistance to others have increased. And most importantly, there is little evidence to suggest the decline of antibiotic resistance in humans, which was the exact purpose of the ban. Clearly, an all-out ban on antibiotics is not the answer. Therapeutic drugs should definitely be allowed, whether that be for treatment or prevention. The question then comes down to the use of non-therapeutic antibiotics. Non-therapeutic drugs are already banned in the European Union and Canada. Phasing out all non-therapeutic antibiotics here would make meat, poultry, eggs, and dairy products more expensive, particularly because the animals will not grow as large and will require more feed. According to a report done by the USDA in 2001, U.S. hog producers saved about $63 million in feed costs in 1993 due to their use of low levels of sub-therapeutic drugs. They would have suffered an estimated loss of $45.5 million in 1999 if the drug was banned. This cost is then passed down to consumers. The FDA has strict regulations regarding antibiotic use in the livestock, as ultimately they will become or produce a product consumed by humans. In fact, antibiotic use per animal is declining. When antibiotics are used, physicians and veterinarians oversee the practice to make sure they are used appropriately. In addition, whenever an antibiotic is given to an animal, a strict waiting or withdrawal period is enforced before the animal can be processed for its meat, so no unsafe residue will remain.